The Department of Justice estimates that healthcare fraud generates roughly $100 billion a year. Unfortunately, that means that this type of crime happens all the time. What's worse is that these schemes are hard to detect and understand. Oftentimes, perpetrators will commit one type of healthcare fraud in order to cover up other parts of the greater scheme. Hi everyone, I'm Elia from eTactics, and today I'm going to discuss another infamous example of healthcare fraud in Florida. Before we get started, make sure that you subscribe to our YouTube channel by clicking the button below. Also, hit that alert bell icon so when we post new helpful content, you get notified. December 2022 was a bad month for healthcare fraud in Florida because Ruth Fernandez was also convicted. You see, a judge sentenced Fernandez to 3 years in prison for her role in the conspiracy to commit healthcare fraud. She was also indicted for making a false statement in a situation involving federal healthcare benefit programs. What happened that led to a woman spending 3 years in prison? According to court documents, the fraud happened from January 2018 to April 2019. Fernandez worked under Patsy Truglia supervision and direction. Truglia received a previous sentencing of 15 years in prison. Under Truglia's supervision, Fernandez generated medically unnecessary physician's orders through telemarketing operation for certain orthotic devices. Referred to as durable medical equipment, or DME, these devices included knee braces, back braces, wrist braces, and other types of braces. Through the telemarketing operation, Fernandez harvested personal information and medical information to create unnecessary DME brace orders. These were then forwarded to purported telemedicine vendors. In exchange for a fee, these vendors paid illegal bribes to physicians to sign the orders. This was all done without ever contacting the beneficiaries to conduct the required telehealth consultations. The illegal brace orders were then returned to Truglia's telemarketing operation. To avoid Medicare scrutiny, Fernandez spread the fraudulent claims across 5 DME storefronts operated by Truglia's control and Fernandez's management. Through the 5 storefronts, Truglia and Fernandez and other conspirators caused approximately $25 million in fraudulent DME claims submitted to Medicare. This resulted in almost $12 million in payments. The judge found Fernandez guilty of fraud. As part of her sentencing, Fernandez had to pay approximately $12 million to the affected government healthcare programs and insurance companies. The court spread this dollar amount across several co-conspirators involved in the scheme. The court also entered an order for forfeiture in the amount of $62,650 against Fernandez. Now that the trial is over and Fernandez received her sentencing, we need to determine what type of healthcare fraud was involved in this case. The conspiracy used medical identity theft to fraudulently place orders for braces. According to the Medical Identity Theft Alliance, more than 2 million Americans were victims of medical identity theft. Medical identity theft involves the misuse of someone's information to submit claims. In this particular case, people stole information from patients to make fraudulent DME claims. This case also includes phantom billing. The patients were never contacted by the telemarketing scheme. They were never patients where Fernandez worked. Therefore, any claims that were submitted were for procedures and treatments that never happened. Billing for unnecessary services or items and upcoding are also present in this case. There's a good chance that the people linked to the stolen information never actually needed braces. Therefore, the claims for the braces were completely unnecessary. If you'd like to learn more about healthcare fraud and healthcare compliance, reach out to eTactics. And you've already made it this far into the video, so you might as well like it, share it, and comment below.